Okay, so what will we do to reduce the risk associated with opioid abuse and other drug-related problems? So this is when I talk about evidence-based policies that center human rights. This is one of the key issues for me um, as someone who researches in neuroscience and has a lot of friends who actually work in the opioid addiction field. I think, and through conversations with them, we've really talked a lot about harm reduction strategies to help people who are injecting drugs. And one part of that means supporting funding for safe consumption sites. The evidence shows that safe consumption sites are beneficial to both people who are using drugs as well as society in the surrounding areas. Safe consumption sites help reduce bloodborne pathogen transmission like HIV and hepatitis. They reduce emergency room visits, and they increase access to countermeasures in case there's overdose, people who are overdosing. And we know that people who are coming out of recovery are the people who come out of recovery are actually the most likely to accidentally overdose. And so having supervised consumption sites is really important to addressing that. And then also it helps people who may not otherwise interface with supportive services and social workers have access to those types of services and start building those relationships with people that may be able to help them. And then I think expanding programs around harm reduction strategies, expanding access to behavioral and mental health professionals for people who are experiencing opioid abuse. And there's also we need to address how opioid abuse and drug-related problems interface with the homeless population as well, and people experiencing homelessness. And that means expanding wraparound services and expanding low barrier housing for people to just basically get them inside first, and then they have access to supportive services.